Welcome to tonight's broadcast, everybody. It's lovely to have you all back with us again. It's been a minute since we've last seen each other, but we're very happy to be here with you. And today we're going to be talking about what it's like to be a medical practitioner within Ireland, and also what the process is for people to register in Ireland, coming from the medical professional's point of view. We're going to look at what's different for South Africans in the medical industry here. A lot of the times we move over and we expect things to be very similar, especially when we talk about we're moving to a first world country and everything. People half have it in their minds that things are going to be so much better here. Everything is going to be fantastic. And then they get here and things are fantastic to a very large extent, but they do work differently. So tonight we've got Bradley and Tracy with us to have a little bit of a chat about their experiences in this. Hi, Bradley. Hi, Tracy.
Hi.
Hi. Hi.
How are you both doing this evening?
Cold.
Doing good. It's not too bad. It's not raining, so that's a good thing.
That's it. You can see we've been here a while. The fact that someone mentions that it's not raining and everybody's like, yep, that's good. Tell us a little bit about yourselves. Bradley, give us a little bit of info about you and your family and how it came to be that you guys are in Ireland.
Yeah, so just a little bit of background. Like, we actually intended to go to Canada initially, and I've applied in 2019. I went to Canada, I got a job, I did all the exams and about to leave, and then COVID started. So we couldn't go anywhere for that like 2 years. And while I was still waiting, I think Canada was one of the last countries to actually open up their borders and for travel, etc. So I was just chatting to one of my friends, and she was in Ireland, yeah, in Kerry, and she was like, "Why don't you just come to Ireland for the time being while you're waiting to get to Canada?" And
Yes.
it's much easier to get into the medical field here. So that's how I ended up coming here. So I came here in 2021. Luckily at that time we didn't need visas and stuff, but I I was able to come with my wife and my one child at that time. She was 3 years old when we came. So yeah, so I just applied, and we'll go through the process and stuff of the applications if there's any questions on that. But yeah, I'm here for 5 years now, and I don't think I'll leave Ireland, so I'm happy and settled into the working environment here as a doctor. So yeah, so that's where I'm at the moment.
Funny how that works though, because for us as well, the plan was not to move to Ireland permanently. Ireland was meant to be a pit stop for us for the process that was available back in the day, where you could come to an EU country that was not the country of your passport and then move on to the EU country that you're actually from. So our plan was to go to the UK. And then we ended up sticking. Funny thing that about Ireland, how it kind of captures you.
Yeah.
Tell me about your medical background, Bradley.
Yeah, so I graduated in South Africa in 2012, and I was fortunate enough to work in the military. So I had a bursary to the military. So I stayed in Pretoria, studied there, and went back home to Durban, and I was still in the military up until 2021. But I just wanted a change of environment and a bit of career progression. So I initially decided like I wanted to either go to Canada, but I ended up in Ireland, and I just came as an emergency medicine doctor. The process was quite straightforward to get here. But when you come here, then you know like the whole medical field is totally different to back home.
Yes. How is it different? And Tracy, I'm going to ask you for your insights and your introduction in a few minutes. So
no problem.
Yeah, so like so when you apply to come to Ireland, you have to firstly do an English test, and we're lucky that we don't need to do as a like medical doctors, we don't need to do any exams. Our medical education from South Africa is equivalent to the Irish medical education. So all you need to do is you need an English test, and if you have that, you just have to provide proof that you've done internship in South Africa, and you upload all that information to the IMC. You pay the fee that they ask you to pay to register, and you get an answer within a couple of months. that you're now eligible to be on the register. And then once you're on the register on the IMC or the Irish Medical Council, you can basically apply for a job in Ireland. There are a couple of recruitment agencies. Like I went through a recruitment agency where you don't need to pay them anything. It's their job to recruit medical professionals. The only thing is, most of them, one of the mandates from the government is because there's such a shortage of emergency medicine doctors that you can't come in directly, for example, to the medical specialty or to orthopedics, etc. You have to come in as an emergency medicine doctor at least for about 6 months to work, and then you can move on to another specialty after that.
And have you moved on?
No, so I actually I enjoy emergency medicine. So I'm in emergency medicine now for 5 years, and I'm just this last 2 weeks I went for an interview to be on the training scheme, like the formal training scheme.
Okay.
So I'm successful in that. So now I'm part of the training scheme. So that's higher specialist training, and it'll be 4 years, and then you become a consultant after that. And then we can also, if there's any questions on that, I'm happy to take questions on that, because it is quite different to South African specialty training in Ireland. It's quite different.
Okay. We'll come back to that in a moment. Tracy, how about yourself? How did you get to be in Ireland?
Yeah, I'm at a different level to Bradley, maybe more behind the scenes. I'm an ex-nurse, but I do medical device sales, and I specifically work in orthopedics. So when we decided we wanted to come to Ireland, I had been here in 2003 working, and I had made a few contacts. So when we decided we wanted to come back, I contacted a few companies and I got a job with them, which then allowed me to get a critical skills employment visa, which is not the norm for sales because it's not considered a critical skill. But because I was in a company or working with devices that were specialists, they needed that knowledge, and they were quite happy to give me that permit because I had specialist knowledge within that field. So that was how I got here.
Was it difficult for you to prove that, or what was the requirements in terms of getting that done? Because a lot of people won't look at it from that perspective. They'll look at what it says on the paper.
Yeah, it wasn't that hard. Look, at the time, I hadn't found you guys yet. It was still, I had Mark's book, and that was about all. And I got hold of a solicitor, and I got them to help me with it. And basically what had to happen is we had to put together quite a substantial CV to submit, as well as making sure that the job description exactly matched what I was saying I could do.
Okay.
And then they looked into that. They had to get a lot of references from the company I worked with, and I had to prove that I had international knowledge. It wasn't just, I worked for a company in South Africa with similar to what you're doing. I was doing the exact same product range that they were selling in Ireland, and it had a high level of technical requirements that I could prove. So that was kind of how I did it.
Got you. And since then, how long have you been in Ireland now?
Since 2019. So yeah, 6-7 years.
What drove you to change over to medical sales?
Well, look, I was in nursing as a youngster, and then I went into medical sales many years ago. But I landed up in orthopedics very early, and for me, it's a nice compromise between nursing and actually you're still in the medical field. You're still part of a team. You're not actually selling. It's called medical sales, but it's not really what we do. We are more part of the team and assisting with the use of our product in orthopedics. It's very different to other types of selling. So it kind of ticked all the boxes and actually paid me more money than nursing did. So
that was happy days. Why not?
Exactly.
So to go back to Bradley here, you've now gotten to the point where you're in the training side of things. How did that differ from South Africa? You mentioned that that process itself is also very different to in South Africa.
Yeah, so I think the first thing is it's very difficult to get into the training program. So how there is requirements that the training bodies have to fulfill in terms of quota as well. You'll that's very transparent. So even when you're applying to get onto the training scheme, they would say, for example, how they select if there's 40 posts, for example, they will say first is Irish and UK will have first preference, and then would be EU, and then would be non-EU at the bottom.
Wow.
So the only way that we can be equivalent with EU equivalent is once you understand four.
Okay.
So for the first 2 years now, when you come in, like you're gonna come on a stamp one. You're gonna get a stamp one when you come in, and or now I think it's a stamp 1H or something like that doctors get, and that's valid for 2 years. And after you finish 2 years, then you'll be put onto a stamp four. So when you're on a stamp four, then you're EU equivalent, then you got a very good chance of getting selected to be on the training scheme. So with the training scheme, so that's the selection criteria, but also in terms of the amount of time you need to be on the scheme. So in South Africa, to become a specialist, on average, it's about 4 years.
Okay.
But here it's 7 years to become a specialist.
Oh, wow.
So you have to do something what they call is a basic specialist training, and they call it BST. In emergency medicine, it's called C-STEM, which is the same thing. It's just a basic level, and that's normally 2 years in the medicine and surgery, and then 5 years for the higher specialist training. So, if they take, for example, 40 people into BST on the basic specialist training, they might only have 20 posts for the higher specialist training. So out of those 40 that's progressing, 20 will be cut off in the end. So it is quite competitive, and obviously some people drop off on their own, like maybe they don't want to continue or they want to do something else. So it is quite competitive at the moment. On average, the higher specialist training posts are about 20 to 25 per year in each specialty. So there's a lot of competition to get onto to the training scheme, and that's the formal training scheme. Like it's through the college, and you get a certificate in the end to say you completed your training, and you can take that certificate and go with you anywhere in the world, like Australia or the Middle East. But there's also another pathway beside the formal training pathway, which is called an alternative pathway, which you can also become a specialist. The only difference between the both is that with the alternative pathway, you are basically doing everything that a trainee does, but you are doing it on your own, and you are not like forced into doing anything. You're not supported because you're not on the formal training scheme. So it is possible to become a consultant or a specialist here without being on the training scheme, but it's just a lot more harder, and you're not guaranteed that you're gonna end up being a consultant or a
Got
specialist.
you. Now, you both work within the medical field and everything, and a lot of the time we have people that are moving over who are trying to compare like for like, and they get very frustrated with the way that the system works because it's so much not like for like. Tracy, in your experience, what is a reason for things being different in the areas that you are in, and how does it differ?
Well, my experience is mainly in orthopedics in operating theatres. And I can say I worked in both the public sector in South Africa and the private sector. And I do the same here in both public and private. So in South Africa, if you were in public sector versus private, there was a massive difference in the standard of care that you received because of the funding that was available. And often, and Bradley, you could probably talk to this as well. In the public sector, they were mainly dealing with a lot more of the emergency type medicine than, your longer term medicine. So hip replacements kind of took a back seat to putting people's legs together type of thing. It's similar here, but the difference is that the standard of medicine in both public and private is really good in Ireland, whereas in South Africa, there was a lot of time, even in private medicine, people don't see what happens in behind the scenes. And the things that I saw happening in theaters, it wasn't properly monitored, managed. Single-use devices would be used over and over again to save money. Even in the private sector, whereas here you don't see that. There's a lot more management according to EU standards. They're very careful about what they do. There are the odd kind of glitches, as we see in the news now and then, but generally speaking, there's a lot more control and a lot higher standards, and there isn't such a difference between public and private in the quality of care that you get in Ireland.
From an end user's perspective, I can attest to that, in that through childbirth, for example. Like, I had 2 of my children in South Africa in private hospitals, and then my younger son was born in Ireland in a public hospital. And the thing that was the hardest for me was how different the process is. But then when it came to the actual experience of having my child in the public hospital here, it far superseded the experience that I had in South Africa in the private hospital. And I think that's very difficult for people to wrap their heads around when they are back in South Africa, because there is such a big difference between the two back there.
Yeah.
Which I find that here, while the hospital looked more clinical and more like a hospital, the care that I received was far superior. It's from my perspective in any ways. But Bradley, on your side, working in the hospital and working in a different level, how does that differ from South Africa in terms of processes and procedures, etc.?
Yeah, so I can say, like, to put it very simple, it's like you're working in a public hospital here, but you almost function like it's a private hospital.
Okay. Yeah.
You have everything that you would need. You have, for example, they have disposable scissor, they have skin markers, they have, every instrument that you can think of. It's like you're in a public hospital, but you have the luxuries of private healthcare. That's the way that I see it. In terms of patient population and the type of patients you see, as we were discussing earlier, like off air before we came on, it's if there's an emergency, you would be seen immediately. You can get from coming into ED to going to a stroke center and getting sorted out within 30 minutes. If you're coming in with flu symptoms, that you could have went to your GP to, or you could have went to somebody else, you might be waiting 11 hours to be seen. So that's the difference. A lot of patients come in thinking that they do have private healthcare, but in Ireland, it's not like how South Africa is with public versus private. When you have private healthcare here, it just means that you can get some elective things done that's non-urgent much more quicker than somebody in the public sector would get if it's something like non-urgent, for example, like a hip replacement. But in terms of the hospital setup and what you got access to, the level of care, the level of consultants, the nursing care, it's almost either as good or even better than private healthcare back home.
And tell me the escalation process that's here. So when I mean escalation, so there's a lot of things that you can only get to once you've been referred to by your GP. Whereas in South Africa, you'd go see a lot of specialists directly without having to go through your GP. Being at that end of it, do you find that the process to which people come into the system is different?
Yeah, so I think initially it was a bit difficult to get to to get to a specialist directly. You had to go through your GP. Again, if it's an emergency, obviously you'd be seen in ED and you'd be admitted and you get to see a specialist. If it's something that's chronic, for example, just say you're having joint pain for the last 2 years and you need to see a rheumatologist. If you do come through the public sector, you might be waiting 6 months for an appointment to see a consultant specialist rheumatologist, because it depends on they triage even outpatients as priority or urgency. But nowadays with VHI expanding and Leia, like the two main
Mm.
private healthcare groups, you can easily see a rheumatologist tomorrow. All you need to do
Mm.
is phone the private hospitals and you can see somebody the next day if you have private healthcare.
Thanks, Bradley. Then, Tracy, in your experience, having spoken to people, and you were quite active in the movement to get spouses of critical skills visa workers to actually have a stamp that allows them to work freely in Ireland. Do you find that there's a lot of people that are frustrated, and what is it that they're frustrated with in terms of the medical system?
Yeah, I think the biggest problem is that people don't see they don't understand how the system works, and there's too much comparing of the private sector that they're used to the public sector. So they expect to have, because they're coming to a first world country, that the public sector must be at the same level as their private healthcare back in South Africa, and they don't understand the way the system works, as Bradley's explained it now. And certainly from my perspective, I always say to people, even if you don't need it, get medical insurance. Now, I mean, at the end of the day, you're not going to get better healthcare. In fact, a lot of the consultants that work in private also work in public, although that is changing. But I think from what I'm understanding, but the point is you can get the same level, if not better care sometimes in a HSC, but you can at least have a bit of a choice. And we had an experience with a family member that had a type of cancer that needed treatment that wasn't available here in Ireland. And because of the medical insurance that they had, we could have taken them to the UK for that treatment. Because it wasn't available here, the medical insurance was willing to pay for it. Now, that wouldn't have been the case if they hadn't had that insurance. They wouldn't have had that choice. They would have had to go through the system and use whatever was available in the HSC for them. So I think that's an important thing for people to remember, that, it's the HSC system is overburdened. They've got massive numbers of patients relying on them. And, a lot of people will go into an ED, which I'm sure Bradley would attest to, for a cough or a cold. It flabbergasts me that the Irish treat it like their local GP. And it just means that the whole system is burdened. So if you do need to be seen, you need to actually try to take responsibility yourself and make sure that you have the tools to allow you to go to the VHI clinic or the Leia clinic and see a consultant earlier if you can.
Now, with the process that there is with waiting in the waiting rooms and then going on to possibly going to a trolley afterwards and everything else that goes along with it, if you do go to your GP first and the GP actually refers you to the emergency department, are you seen to quicker?
No.
So
it depends on, because you're triaged when you come to the hospital. So this
Yes.
is the triage system. So like beside that, I think the one other thing that people abuse is the ambulance service, and they believe that if an ambulance bring them in, they'll be seen quicker as well. It's also not true, because it's based on how you triage and what category of what's the problem actually. So what category you put in. So you can, because the ambulance service here is like totally different also to back home. Like they can't refuse any patient, and it does.
Okay.
Like I work with pre-hospital as well, so we we go out like once a week with an ambulance. We got our own vehicle, so it's a pre-hospital medicine, and you'll be surprised at what people call the ambulance for. And the ambulance service is not allowed to refuse any call, number one. And if a patient says they want to go to the hospital, no matter how, even if it's for a sore thumb, the ambulance will have to transport them to the hospital. Like they can't.
That's mad.
It's crazy.
So on a daily basis, the average number of patients that come through ED on a daily basis now is about 350 per day. And in UHL, that's why it's one of the busiest hospitals in the whole island. And out of those 350 patients, I would probably say around maybe 30 actually are emergency medicine, like, needed to be in the hospital. The other
Yes,
320, they should be seen outside of this hospital.
that's bad. So for my child's birthday that's upcoming in September, if I really want to be the cool mom, I can pretend that he is injured and we need an ambulance ride.
Yeah, yeah, yeah. To be honest, like it was in the news recently. Like people are using the ambulance service like a taxi. So I don't know if you saw that in the news, but you get a person that's like drinking and drunk coming out of a pub and they can't get a way home, so they call the ambulance. And when they're almost like passing somewhere close by to their home on the way to the hospital, then they're like, no, I'm fine. Like I want to get out of the ambulance now.
Imagine that.
And it's been happening. Like you hear those stories from the ambulance crew themselves.
See, I knew we bought in the wrong area because if I had to take the ambulance, it'll take me an hour away from home.
Yeah.
and there's nothing coming towards home.
Yeah, so going back to that question. So if your GP refers you in, it should be like an emergency as to why they're referring you in.
Yes,
They cannot like GPs are not supposed to be referring in, for example, a patient with a headache for 5 months, because there are other avenues for that. Like we have medical assessment units and there's local injury units that can deal with those type of issues. A GP can even refer directly to a neurologist through their system. The only issue with that system is that there's long waiting times.
yes.
But sometimes out of frustration, out of not being able to get an appointment for this patient or the patient coming in every second week, then they just do a letter to ED for us to see the patient, which we most of the time end up sending the patient back to the GP.
Which is very frustrating, I'm sure, for
Yeah,
the patient at the end of
yeah,
the
yeah.
day.
No, it is. It's really frustrating for the patient. It's just a system that's overwhelmed at the moment because of the increase in population, like the growth spurt that Ireland has had over
Mm,
the last few years. It's phenomenal, like how the numbers have increased. Um,
yes.
and also with like there's other factors like an aging population with more complex needs and demand, and it puts a lot of strain on the emergency department.
And that's also one of the things, like when we came over with how things work different. Like I took my son to the GP for a cold and I was told to give him lemon and honey, which back in South Africa I would have ended up with a 1,000 rand pharmacy bill at the
Yeah.
after seeing the doctor. So there's big differences in the system like that, and I just had to remind myself that the life expectancy in Ireland is much higher. So clearly they're doing something right
Yeah.
in terms of how they look after their patients. Any advice that either of you can give people who are thinking about coming over, Brady, from your perspective within the medical industry directly, and Tracy, from your perspective in terms of people, what they will experience on the side, what to be prepared for?
So I think, like, obviously I can only speak on behalf of doctors now, but if you're planning to come here as a doctor, whether you want to come as a GP, and that's a total different subject now. It's not that easy compared to back home to become a GP here because it's a specialty in Ireland. But just say you just plan on coming as a doctor in emergency medicine, for example, but you want to go into medicine, orthopedics. The best, the advice that I would give is, because here we have, when you qualify, you become an intern, and then after internship back home in South Africa, you become a medical officer, and then you become a senior medical officer. Here, it's the terminology is a bit different. So you, after internship, you become an SHO, which is a senior house officer, and then you become a registrar. So a registrar is like a senior medical officer. So a lot of people come from, so like I came to Ireland as a registrar just based on my experience from back home and the time that I've qualified. But there's a lot more responsibility when you come in as a registrar compared to a senior house officer.
Mm.
So my advice would be, if you are planning on coming, that you come as a SHO or a house officer. Now the pay is a bit less, but your responsibility is much more less as well. So it gives you time to learn the system, because it took me about 3 months to actually get used to how everything is done in the hospital. it's totally different to back home in terms of your clinical skills would be the same, but there's pathways, there's guidelines, there's protocols. In Ireland, the medical legal side of things is huge.
Huge.
So everybody will be on your, even if you prescribe something that's wrong, the pharmacist will ring you while you're at home to ask you, are you sure this is the right medication, for example. So it takes time to learn the system. And then if you come in as a registrar, you just put into the deep end and you probably will even think about leaving or going back home. But my advice would be like, if you are planning on coming over, you need to come in as an SHO, number one. And number two, don't expect to just come into the system here and then be put onto the training program or try to specialize. It's not that easy. So it will take you a bit of time to get to training and to become a consultant here. Whatever you've done in South Africa doesn't really matter when you come here.
Okay. So that is very, very sound advice for people that are thinking about it, so that they don't have the rose-colored glasses on.
Yeah, I'll be honest, like there is a very good work-life balance that's taken very seriously in healthcare, is that you're not allowed to work a certain amount of hours. So you would have a very good, we don't work as hard as we normally in terms of hours and shortage of staff, like back home in South Africa, where you'd work a 24-hour shift or you'd be on call and you need to come back the next day. Here in Ireland, they take your working hours and your post call and mandatory day off, etc., very seriously. So you would have a very good work-life balance when you come to Ireland, and the money is better than back home.
Okay.
The cost of living is higher, but for an example, I'm the only one that's working at the moment. My wife is by choice at home. Not by choice, she wants to work, but I wanted to stay at home because we have two kids and healthcare. I mean, paying for a nanny
Okay.
and stuff like that
Yes.
is she'll just be working to pay for the nanny, to be honest. So she's at home, and I'm the only one that's providing an income at the moment, and we live quite comfortable. I won't lie to you. Like I bought a house 2 years ago, and we have two vehicles. We go on holidays, and it is if you're coming in as a doctor, like it will be comfortable in terms of the salary and the pay that you get for the amount of work that you're doing. I think
Yes.
you'll get paid pretty well.
So she's at home not by choice but by husband.
Yeah. It just makes my life easier if she's at home.
No, we had the exact same thing as well. So I was at home for the first 4 years after we moved over, just purely because of the cost of childcare. It wasn't feasible for me to work an entire month just to pay for someone else to look after the kids, so that I can go work the entire month to pay for them to look after the kids while I'm at work.
Yeah.
So it turned out in hindsight to be one of the biggest blessings in my life to have that experience, because in South Africa it wouldn't have been an option for us. So, and Tracy, from your perspective,
I think the biggest thing would be if you are planning on coming and you with a family. The only advice I can give from my perspective is I made sure I had all my medical histories of the family, because I think that kind of gets forgotten. You have a whole history behind you of your kids and what's happened, and you then go and see a GP and they kind of don't have a lot of time, and you want to be able to give them the nuts and bolts of what the issue is, and just understand that a lot of the time the diagnoses that you receive in South Africa are not accepted here. So you may have to go the route of kind of redoing everything. So it helps to have that documentation with you that can help guide you. And then as a patient, just to get medical insurance, because as Bradley said, if you come in at a young age, you're paying minimal medical insurance fees, but when you need it, you're not going to be paying a lot,
yes,
because it adds up. And the older you get, if you're starting at an older age, it's a much higher cost. And then you can't get, a complex plan. You have to have a basic plan, and then you really can only fit into the HSC system, and which is already overloaded. So then you're going to be waiting for your hip replacement that you want for
and I think
3-4
it's
years.
also compulsory now to have medical insurance to renew your stamp.
That's, yeah,
Yes.
it is if you're on a work permit, but it isn't if you are coming in as an EU member. I don't think you need to have
No.
insurance then.
You don't need it if that's the scenario, or if you're coming in with a British passport, for instance, also you don't need it. But just for anybody listening to this, it's 35 is the cutoff age. So you can go after the age of 35 without having private medical insurance. But should you take it out at a later stage after 35, there's a surcharge of 2% for each of the first 10 years that you don't have it. And then if you are coming over after the age of 35, like say, for instance, you're 40, when you come over, you've got 9 months from when you arrive that you're exempt from taking out private medical insurance without that surcharge applying to you. But should you take it out after that, it is applicable.
That's no, what it is if you have got medical insurance or medical aid in South Africa, you need to prove it, and that you have 9 months to do that. And after that, it doesn't matter what you prove; they're still going to put that surcharge on. So it's actually ironic because on the other side, Discovery doesn't accept Irish medical insurance. They put a surcharge on if you go back to South Africa, interestingly enough. But here, the Irish insurers do accept medical aid letters.
Yes, it's not that surprising, Tracy.
True.
They would want money just for the sake of it.
Yeah,
no.
100%.
No, but both of you, thank you so much for making the time to join us today and have a little bit of a chat to give people perspective about the other side of the coin. I think a lot of people forget that in part of the preparing to immigrate to another country is the more knowledge you have about things, the more confident you are in what it is that you're doing, and the less overwhelming things feel. So combined with the broadcast that we had previously for people who have had experiences within the Irish medical system, and this one now getting an insight onto the other side, from the other side of the lens, I hope people are able to make decisions that will help them and arrive here a little bit more confidently. And it's a little bit easier for people to navigate what lies ahead for themselves. But both of you, thank you so much for joining. It's been an absolute pleasure having both of you here, all the insights and the information, and for putting your hand up and saying, here, I'll come and have a chat about this. Really appreciate both of you.
Yeah, thank you so much, Vicky, for inviting us. And I'm on the South African in Ireland, or moving to Ireland group, I think still. So if anybody wants, they can message me, and I can give them more details on the actual application process and how to get over if they're planning on coming over.
Happy days. I am going to put your name in here quickly in case anybody wants to reach out.
Perfect. And the same for me. If anyone's got any questions on the other side, it's a very different aspect of the business. There's a lot of South Africans in the medical device industry, so the more the merrier.
Happy days. Let me just make sure, Tracy, your surname is looking weird for me in how I typed it there, but there we go. Bradley, Tracy, thank you so much, both of you. Have an absolutely fantastic evening.
Thanks, Vicky. You too.
And
thank you.
Thanks again. Take care.
Bye.
Bye.